More Colorado children are getting sick from COVID-19, and cases in the state keep going up.
The Delta strain is affecting more people who are vaccinated. Today, the state health department reassured the vaccine is still the best protection against COVID, saying that people are less likely to end up in the hospital or die. Data says more people with the J&J vaccine are getting sick, followed by Pfizer, then Moderna. And Colorado kids now make up more than 27% of all the COVID cases in the state right now.
Obviously, this wave of the pandemic is unique, both here in Colorado and across the country, in that we are seeing more of an impact of COVID-19 on our pediatric population or school-aged population.
Nearly 900 Coloradans are in the hospital right now with COVID. More than 5% of those patients are 19 years old and younger. CBS 4's Michael Abeyta joins us live tonight. Michael, should parents be worried about this?
Well, Karen, you know, cases are the highest they've been since January. And as you noted, increasingly, many of those cases are pediatric cases. And some parents may be wondering, with school starting and everything, are my kids safe? Doctors have been adamant that COVID-19 is spreading among the unvaccinated. And it's easy to forget that includes children who may be too young to get the vaccine.
Our highest rate of transmission, and it's been that way for the last couple of weeks, is really occurring among that 6 to 11-year-old population.
Dr. Reginald Washington, the chief medical officer of Rocky Mountain Hospital for Children, says he sees the same thing in his hospital.
But we, up to this point, have adequate capacity, nurses, etc., so we're not under stress at the moment.
And while it would be easy to blame the start of school for the spread, Dr. Washington says that may not be the case.
Kids are out and about, they go to school, they're exposed to adults, so we really can't do a lot of contact tracing.
He says they found that most kids are not hospitalized by COVID, but they have seen some deaths. His advice, if you have a sick kid, take them to a doctor.
Just because a child may have COVID or not have COVID, if they're sick, they need to be seen because they could have RSV or some other illness.
And he urges parents to be smart about what they let their kids do and who they do it with.
Playing outside is a good idea. Playing inside, maybe not. Being around a bunch of adults who are not wearing masks is probably not a good idea.
Now, Dr. Washington says it's important for parents to know and to make sure that their kids know that social distancing, masking, and washing hands are very important steps that they can do to keep their kids safe. But the most important step that parents can take is to get vaccinated against COVID-19 themselves. In Denver, Michael Abeyta, covering Colorado First.